let's talk a little bit about bone loss. So many of you may be thinking, what does bone loss have to do with COVID? The big thing right now, the big thing that's going on for most people are the big lockdowns. And so depending on where you live in the world, if you don't live in Texas, not quite as bad of a lockdown, let's say, as like California or New York, but people are being locked in their houses. And the big thing that's happening is that lack of physical activity, and nothing degrades or increases the risk for bone deterioration more than lack of physical activity. So this is going to be one we're going to focus a little bit on. So those of you who may be in a kind of a more draconian area, I'm going to show you some things that you can do. So stay with me. I'm going to show you some things that you can do, even if you are in the lockdown, that are going to help with this. Additionally, one of the things that we know can impact bone loss right now is the alcohol consumption. So this is way up right now. So alcohol percent consumption is way up. Sales are way up. People are buying alcohol. Why? Because they're trying to cope, right? The stress of what they're experiencing is being treated, we'll just say self-treated, with alcohol. So depending on, some people take pain medications, some people take sleep medications to try to kind of shut themselves off, but a lot of folks are self-treating right now with different forms of alcohol. So again, alcohol increases bone loss for a number of reasons. It can cause nutritional deficiencies, as being one of the main reasons. It causes the loss of water-soluble nutrients. It puts more pressure and stress on the liver, elevates blood sugar. Of course, all these things have been linked to an increased risk of bone loss. So these two things specifically, right now with what's happening with the lockdowns. So COVID lockdowns are generating a lot of lack of physical activity, are generating a lot of alcohol use right now. Now, some of these other things, not so much, but we'll dive into them. So interestingly enough, bone loss risk factor also can be excessive exercise. So if you are overdoing it, we call that overtraining syndrome. It's when you can actually increase your risk for bone loss. Ladies, you're at greater risk than men just by the fact that you don't make the testosterone, you don't have the muscle mass, right? So smoking, hopefully nobody listening or tuning in tonight is doing any of that. And then a history of bone fractures is this is kind of more if you've had this and you don't know why. And so maybe we should really specify this one by saying non-traumatic, specifically non-traumatic bone fractures. And when I say non-traumatic, I mean like an accident, which is a form of trauma, but a light trauma. So like not like a car accident or something major, but just something like you fell back and you shouldn't have broken a bone. There wasn't enough pressure there. There wasn't enough weight there, but like a minor fall or something of that nature. But fracturing the bone in an easy way. So in essence, the bone fractured. If you've got that going on, this is something you're going to want to get checked out. If you've got a non-traumatic or a mildly traumatic injury that led to a fracture, you might already have accelerated bone loss. If you've got a family history of bone loss, you're at an increased risk. And then frequent pregnancies because of, this one is because of this one. So like frequent pregnancies, worst case scenarios that I see in women that have had multiple children, especially back-to-back children where there wasn't a gap, like a year or a 2-year gap in between pregnancies, is severe malnutrition. Some of the worst nutritional deficit lab work I've ever seen was from pregnant women who are going into a second pregnancy, or from pregnant women after breastfeeding, because baby takes it all. And so frequent pregnancies and nutritional deficiencies. Super, super common. Hey, don't forget to check out the rest of the series right here. Make sure you hit subscribe below. And as always, thanks for tuning in.